For years, women have warned one another about the pain of getting an IUD. Now, the CDC is changing its guidelines for the first time since 2016 to improve the patient experience. 9 News reporter Rachel Krause is here, and Rachel's doctors say these changes are years overdue.
Yeah, doctors say the stories of women passing out or screaming in violent pain aren't unique. We spoke with one patient who's used to extreme pain, dealing with it regularly because of endometriosis. But after her first IUD, she was crying and barely able to walk. She's grateful these guidelines are changing, but says it should have happened a lot sooner.
So this is the IUD itself.
So small, and for many women, so painful.
And then to be totally frank, putting a plastic object within an internal organ doesn't sound like it wouldn't hurt, right? It sounds quite painful.
That's something Micah Alexander knows well. Her first time getting an IUD was rough. Her doctor prepared her for a little pinch in the pelvis.
I would easily rate it as the most pain I've ever been in. Afterwards, I was not able to walk without support. And I remember when we went to check out, my mom was there with me, and I was just like laying on the floor crying because I could not think about anything other than how much pain I was in. So,
Dr. Olga Muldoon, a gynecologic surgeon at Advent Health Porter, says Micah's experience is one she knows all too well.
The first time I got an IUD, it was excruciating and I was completely underprepared. And that's the truth for most patients. Unfortunately, I find that a lot of patients will say that their first experience or their first several were really painful.
IUDs are used by millions of women. They're the third most common form of birth control. But for years, preparing women for the pain or offering a way to manage it wasn't common.
It's not just frustrating, it's a disservice to women.
For the first time in 8 years, the CDC is changing its guidelines for IUDs. Now, they recommend doctors counsel patients on pain ahead of that procedure and offer options to manage it. Sedation, muscle relaxers, or pain medications to ease the trauma of IUD insertion. Dr. Muldoon says she and her clinic have been offering these for years.
I think that we knew all along that IUDs were painful, and for certain individuals, the right thing is not just to do it cold turkey, the right thing is to offer them pain control. So for me, it's frustrating that it took us this long to come up with guidelines that likely should have been in place for quite a while.
Micah says she went to Dr. Muldoon when she needed her IUD replaced. Pain management talks were front and center.
having her take me seriously and then find out what was wrong and help me get treatment for it was a breath of fresh air.
I think the fair thing is to allow them to know their own body and to tell you what the right thing is for them as opposed to the other way around.
Dr. Muldoon says these new recommendations should help to ease the anxiety, pain, and trauma for many women who use IUDs. But she says it's important to be your own best advocate when you seek out this care. If you need more information or you believe that you need pain management, talk to your doctor about it. And if they don't listen to you, find a provider who will. Rachel Krause, 9 News.